Hello and welcome to the roundup of day 2 of the proceedings of the Irish Nurses Midwives Organisation's 93rd Annual Delegate Conference here in Killarney. Today, Thursday, we had a really crowded agenda, a really invigorating day. It began with motions this morning talking about the overuse of the full capacity protocol, the inappropriate placement of patients on trolleys in wards added to the patient complement, and how that compromises the care of all patients, and how it overworks nurses and midwives, and they feel they cannot practice safely. We then, following on from that, had a tremendous debate about safe practice and the tools for safe practice. And by that we meant how people identify risks in their workplace, how they record those risks, who they notify about those risks. And we also gave people and delegates a patient dependency tool, which is now going to be placed on the INMO website in a restricted area for members only, which will allow members to determine, have they got the appropriate staff necessary to meet the needs of patients? Can they provide the full care plan? And we have a very detailed tool that members can utilise. All delegates here today were also asked to carry out a ward census. So we are currently 300 delegates are ringing back to their wards and community care areas to establish what actual staffing they had today, and we're going to use that with the University of Leeds and Professor Keith Hurst to draw up an actual staffing level arrangement that existed in Ireland across the country today, and we're going to compare that with the NHS levels and so on, in order to get a benchmark and establish once and for all how understaffed the wards and workplaces are in the Irish healthcare system. Conference then had a special keynote address from Nora Casey, of Dragon's Den fame. Nora is a registered nurse and originally worked with the Royal College of Nursing. Nora detailed 10 steps to success, and without going into all of them, I think 2 of them that come to mind were, one is break the rules. And she quite clearly told the conference delegates that they have, if they're challenged, if they feel the rules are constricting them and making wrong things happen, they should speak up and speak out, and that was certainly told. And the other thing was be innovative and build strong teams, and that nursing is, as she used a great phrase, that when medicine ends, that's when nursing begins. And she used personal examples of that, which I think raised everybody up in the room and told us all that nursing and midwifery are highly valued professions, and that we can never stop advocating for what is right and for what patients require. This afternoon then we had the election of standing orders in relation to how we internal organisational issues, and then the last session was dominated, I suppose, again by the whole question of the placing of additional trolleys on inpatient wards, and the conference decided that we are in future in our daily trolley watch to include all trolleys that are in anywhere in the hospital, not just in the emergency department, but in inpatient wards, corridors or other inappropriate places. So this is being done to try to prevent management getting away with trying to hide the level of overcrowding in the country's hospitals. And then finally we had a debate which quite clearly unanimously decided that the organisation will oppose any attempt to reduce further the pay, allowances, premiums or increments of our members. And we were quite clearly decided that the agreement we have, the Croke Park agreement, protects rates of pay, not just core pay, but rates of pay. And conference decided that in conjunction with our colleague unions in the 24/7 Alliance, the INMO will do whatever is necessary to protect the total pay of our income as provided for in the Croke Park agreement. And as was said, any attempt to break that will undoubtedly be the straw that breaks the camel's back of that Croke Park agreement, and the conference told government hands off. So a very, very busy day today. Tomorrow we have day 3 with the Minister attending and the presidential address and so on. So I'll update you with that tomorrow evening and round in day 3 roundup. But thank you for joining in. Please pay attention to the website. Please keep in contact. Stay informed. Thank you very much.